Today, we'll explore how different types of fats affect our insulin resistance. This is a term used to describe the body's incapability or inability to use insulin effectively. If we can tackle insulin resistance, diabetes type 2 will be gone from your body. Once we reduce or eliminate insulin resistance, insulin can work much more efficiently, and even for diabetic type 1 patients, may be able to cut down their insulin dose. Insulin is a crucial hormone that regulates our metabolism. It helps our cells use glucose for energy and tells our body to store excess nutrients. But when cells stop responding properly to insulin, we call this insulin resistance. Now, you might think insulin resistance is all about sugar, but fats play a big role too. Some fats can increase inflammation in our body, while others can help reduce it. This inflammation is key to understanding insulin resistance. Let's start with the bad guys: omega-6 fatty acids and saturated fats. These are found in many processed foods and can promote inflammation. Two main culprits are arachidonic acid and palmitic acid. But on the flip side, we have the good guys: omega-3 fatty acids like EPA and DHA, which can help fight inflammation. Our body has several organs that are affected by these fats. The main players are the hypothalamus in our brain, our fat tissue, liver, and muscles. Each of these responds differently to various fatty acids. Let's begin with the hypothalamus. This tiny part of our brain is like the control center for hunger and fullness. When we eat too many saturated fats, it can cause inflammation in the hypothalamus within just 24 hours. This inflammation messes with our hunger signals, making us want to eat more. But there's hope. Our hypothalamus has special receptors called GPR120 that respond to omega-3 fatty acids. When these receptors are activated, they can help reduce inflammation. So, eating foods rich in omega-3s might help keep our hunger in check. Wait, there is more, but do not forget to hit the like button and subscribe, down below. Next up is our fat tissue. We often think of fat as the bad guy, but it's actually designed to store excess energy safely. Problems start when our fat cells get too full. As they expand, they can become inflamed and resistant to insulin. In a lean person, only about 10% of fat tissue is made up of immune cells called macrophages. But in an obese person, this can increase to 50%. These macrophages release inflammatory substances, making insulin resistance worse. Our liver is another key player. It's like a central factory for our body, producing glucose when we need it. But when it becomes insulin resistant, it keeps making glucose even when we don't need it. This leads to high blood sugar levels. Fatty acids can affect the liver in different ways. Saturated fats can increase inflammation and insulin resistance. But unsaturated fats, especially omega-3s, can help reduce these problems. Lastly, let's talk about our muscles. They use a lot of glucose for energy, so they're important for controlling blood sugar. When muscles become insulin resistant, they can't take in glucose as well. This leads to higher blood sugar levels. Interestingly, exercise can help muscles use glucose even when they're insulin resistant. This is why physical activity is so important for managing conditions like diabetes. Now, you might be wondering how all this relates to our diet. Well, the types of fats we eat can greatly influence insulin resistance. A diet high in saturated fats and omega-6 fatty acids can increase inflammation and insulin resistance. But a diet rich in omega-3 fatty acids can help reduce these problems. It's not just about avoiding bad fats, though. Adding good fats to our diet can actively help. For example, omega-3 fatty acids can activate special proteins in our fat tissue that improve insulin sensitivity. So, what can we do with this information? First, we can try to reduce our intake of saturated fats and processed foods high in omega-6 fatty acids. Instead, we can focus on foods rich in omega-3s, like fatty fish, flax seeds, and walnuts. But diet isn't the only factor. Regular exercise, getting enough sleep, and managing stress are all important for keeping insulin resistance in check. Understanding the role of fatty acids in insulin resistance gives us powerful tools to improve our health. By making smart choices about the fats we eat, we can help our body use insulin more effectively, potentially reducing our risk of conditions like type 2 diabetes. I'll create an updated table with both omega-6 and omega-3 values for various foods. Please note that the values are approximate and can vary depending on the source and preparation method. Based on the search results, here are some foods that contain palmitic acid. Palm oil is the richest source of palmitic acid, containing 41,000 milligrams per 100 grams, or about 40 to 47% of its total fatty acids. Other foods high in palmitic acid include 1. Shortening, 26,000 milligrams per 100 grams. Shortening is a type of fat that is solid at room temperature and is commonly used in cooking and baking. It helps create a flaky or crumbly texture in baked goods, such as pastries and cookies. 2. Unsalted butter, 24,000 milligrams per 100 grams. 3. Lard, 23,000 milligrams per 100 grams. Lard is a semi-solid white fat product obtained by rendering the fatty tissue of pigs. It is distinguished from 4. Beef tallow, 23,000 milligrams per 100 grams. Tallow is similar to lard. It is a product derived from the fat of cattle or sheep. 5. Cocoa butter, 25.4% of total fatty acids. 7. Olive oil, 7.5 to 20% of total fatty acids. 8. Milk and dairy products like cheese and cream. 9. Meats, including beef, pork, and chicken. 10. Coconut oil, 8.2% of total fatty acids. 11. Soybean oil, 8 to 13.3% of total fatty acids. 12. Sunflower oil, 5.7% of total fatty acids. 13. Eggs, 1.90 to 5.90% in hen eggs. 14. Palm kernel oil. 15. Flaxseed oil. It's worth noting that palmitic acid is found in many common foods, but the amounts can vary. Animal-based foods like butter, cheese, and meats tend to have higher concentrations, while plant-based oils have varying amounts depending on the source. The average dietary intake of palmitic acid is around 20-30 grams per day, representing about 8-10% of total energy intake. Reducing insulin resistance as a type 1 diabetic can significantly improve how your body responds to insulin, both from injections and naturally produced insulin, if any. While type 1 diabetes primarily results from the autoimmune destruction of insulin-producing beta cells, insulin resistance can still develop, particularly if there is weight gain, physical inactivity, or other contributing factors like metabolic syndrome. Here's how reducing insulin resistance may help. 1. Lower insulin requirements. Impact. You may be able to lower the total daily dose of insulin, basal and bolus. If your body becomes more sensitive to insulin, smaller amounts will be more effective at controlling blood sugar. Reduction amount. The exact reduction depends on individual circumstances but could range from a 10% to even 50% reduction in insulin needs depending on factors like diet, exercise, and weight loss. 2. Better blood sugar control. Impact. Reduced insulin resistance can lead to more stable blood sugar levels, avoiding wide fluctuations, e.g., spikes after meals or prolonged periods of high blood sugar. Benefits. Better control of blood sugars leads to fewer long-term complications, e.g., neuropathy, eye disease, cardiovascular problems. 3. Lower risk of hypoglycemia. Impact. With improved insulin sensitivity, you can manage blood sugar with lower insulin doses, reducing the risk of taking too much insulin and causing low blood sugar, hypoglycemia. 4. Weight management. Impact. Losing weight, especially if overweight, often leads to improved insulin sensitivity. As you lose weight, your body's cells require less insulin to help glucose enter them. Ways to reduce insulin resistance. Exercise. Regular physical activity, especially strength training and aerobic exercise, improves how your body uses insulin. Diet. A diet rich in fiber, whole grains, vegetables, and lean proteins, and low in processed carbohydrates and sugars can improve insulin sensitivity. Weight loss. For those who are overweight, even a modest weight reduction can significantly improve insulin sensitivity. Sleep and stress management. Poor sleep and chronic stress can both increase insulin resistance, so addressing these factors can help improve control. By focusing on reducing insulin resistance through lifestyle adjustments, you might experience significant benefits in your insulin therapy management. Would you like more specific tips on reducing insulin resistance? Disclaimer: consult your healthcare professional before changing your medication or lifestyle. None of the information provided by this video is a replacement for your physician's advice.